Here at our office, we allow an hour for our dental routine cleanings. Some offices it's 45 minutes, some 30, but we like to spend the time with the patient first comes in. We make sure that nothing's bothering them so we can allow for an exam afterwards or x-rays. But our cleanings first involve me checking their gums, checking their health of their gums, measuring the areas around them. Then I'll use an ultrasonic scaler. What that does, it goes underneath the gums. It breaks up the layer of biofilm under the gums and the harder pieces of plaque. And then I use my hand instruments because with hygiene, it's a tactile sensitivity. And so I go back over and make sure, fine scale it, make sure the teeth are smooth and clean so that the gums can reattach and stay healthy. Sealants are usually a preventative measure for children. We we place the material on their biting surfaces of their teeth, usually the molars, that are cavity-free. It's painless, non-invasive. The children, it takes maybe 2 minutes a tooth, if that much, and then it helps prevent dental decay later for the kids, as long as they're brushing well and not eating a lot of hard, chewy candies and things. Long term, it's going to get them through usually their years of not brushing as well, because we just kind of etch out the top of the tooth a little bit and just put a white, it's kind of like a covering, kind of like a blanket over the tooth, just to prevent the acids and the sugars of getting in the crevices and causing a cavity. So it's to get them through their adolescent years to where they're brushing a little bit better.